Hello, we are Dia Alwadi, an orthopedic resident from Jordan.
So America Chiaparelli, Spine Research Fellow at HSS, New York.
And I am Iskandar Manzur, a neurosurgery resident from Syria.
And we are all members of the new AO Spine Youth Club. Welcome to the Expert Insight series, where we interview worldwide expert spine surgeons who generously share their professional and personal experience with us.
So in this interview, we are honored to be joined by Dr. Khalid Salem. Dr. Salem is a distinguished consultant orthopedic spinal surgeon based on Nottingham, UK, who specializes in all areas of spinal pathology, including minimal access spinal surgery, as well as neck surgery, deformity correction, tumors, and spinal trauma management. He is an expert in robot-assisted surgery and he favors evidence-based methods for the treatment of his patients.
Dr. Khalid has an excellent educational background, and he's a member of many reputable professional organizations. And he's also an AO Spine faculty member. In addition to this numerous consultant role, Dr. Khalid is the head of service and the fellowship director for the Center for Spinal Studies and Surgery, Queen Medical Center.
Good evening, Dr. Khalid.
Hi, everyone. Thank you very much for inviting me.
Thank you for accepting our invitation. How are you today?
I am very good. Thank you very much. Thank you.
Thank you. So, at the beginning, could you please tell us your full name, specialty, and full current position?
Yeah. So, my name is Khalid Salem. I am a consultant orthopedic surgeon by training, spinal surgeon practicing. My practice is purely spine and has been since 2015. And my current position is I hold two within my department. The first is I'm the head of service at the Center for Spinal Studies and Surgery in Nottingham, but I'm also the Advanced Spine Fellowship director within the same center.
Oh. Okay, so could you share a bit about your roots in your hometown?
Sure. So I am a Jordanian origin. I grew up in Jordan before going to medical school and then leaving Jordan to pursue further training in the UK. I finished my basic training in the UK, started initially in a small city close to Cambridge, and then eventually moved to Nottingham in 2001. I've done in the UK, we've got some sort of a relatively long training program. So I did my basic surgical training in the Nottingham area, took a couple of years off to do a doctorate in medicine and in the University of Nottingham, and then I went back into formal what you'd call orthopedic residency outside, but it's a higher surgical training within the UK. I finished that in 2013 and then did a fellowship in Nottingham, where I'm currently working for a year before going to Vancouver for another year between 14 and 15, and came back to where it all started and was appointed as a consultant in Nottingham in 2015, and I've been working there ever since.
Wow, long career. That's good.
Interesting.
That's a quite a journey.
Yeah, it usually is. Start times for surgeons in the UK tend to be slightly behind other countries because we don't have the accelerated 5-year program. There is a fairly substantial training program for a number of reasons, but it's all fun, and it gives you a lot of exposure to multiple specialties. So you end up being quite rounded in how you think about things, and makes you a little bit different, maybe a little bit more mature by the time you become a consultant. But there are pros and cons to that.
That's good. That's good.
That's great.
So, Doctor, could you share with us how you started in spine surgery? Why did you choose the field? Why do you think? What do you think are the pros and cons of becoming a spine surgeon?
So the choice for spinal surgery was one of exclusion. So I really struggled with a specialty that would keep me interested, to be honest. During the orthopedic training, you go through all kinds of different things, and then we have within orthopedic training 6 monthly placements, and the training program spans 6 years. So the only specialty that kept me really interested till the end of a 6-month training placement was spinal surgery, as opposed to, for example, other things. And I thought that that was a good start. I repeated the position again towards the end of my training, just to make sure that I'm still interested. And I was, and that then fed into my fellowship choice. But what that also did is it made my teachers at the time, my supervising consultants, see the interest I have for the specialty, because I was interested. I was excited to come and see new things and so on. And that's probably the thing that sealed it for me, is the fact that I felt that there was a constant challenge every day with different cases. No two patients are the same, and even the procedures are a little bit different. So that was the thing that attracted me to the specialty, and it still to this day feels that way, even with basic procedures or diagnoses. As for the other, like I would say, slightly more maybe mature reasons for choosing it, I suspect it's making a difference. I think there is a substantial amount of work done in other fields of, at least I can only speak about orthopedics. In orthopedics, where you really the contributions of one man is probably not going to be noticed, while in spinal surgery the amount of unknowns are such that you can actually make a difference. And that's why I still like it, is that even through training you find that you're changing people's views, you're making them think differently. So it's a nice field to be in, and research in it is easier, I would say, probably from a selfish viewpoint, because there are, because of the amount of unknowns, the choice of topics that you can actually deep dive in is many, which makes it easier for you to stick to something that you like and just interrogate it more and more and more during career.
Thanks for sharing all that information with us, Dr. Khalid. So now, thinking about your professional journey, who inspired you the most to become the surgeon you are now, and why?
I mean, I think different levels of my life have different inspirations. My father's an orthopedic surgeon, so I certainly wanted to do something that would maybe make him proud, but also try and copy his style of work ethic, kind of dedication, and so on. But as my career progressed, also I started thinking or seeing some of my tutors as mentors. So a person that really inspired me is a gentleman I saw in my fellowship in Vancouver called Dr. Charles Fisher, who is an amazing educator, an excellent surgeon, and a fatherly figure who just basically constantly taught without judgment or prejudice, which I thought was fantastic.
Yeah.
And he was an amazing academic. And another one of my colleagues who I actually work with now, whose age is really not far from mine, but he was one of those who empowered me to do more without fear of being judged, as long as I managed to explain or justify my actions. So his name is Nasser Qureshi. He's an excellent researcher, a very good boss when I was his SHO, and an excellent colleague as I'm his head of service now. But but yeah, he's been influential for sure in my career.
Interesting.
Oh, it's always important to have a mentor. I think those are the things that could change your entire career path.
Correct.
When it comes to
Yeah,
career.
absolutely.
So taking into the account that you have work in different settings, and this is important, I think it's great that we can talk about this with you because you have been working not only in the public setting, but it's in the private setting as well. So do you think that the health system features can influence the work of a spine surgeons?
So I think if you're trying to compare public sector practice from private sector practice, then I think it really depends on how you look at your relationship with your patients. So if you feel that what you're doing in either sector is purely trying to help, then really the standard of practice between the two shouldn't be different. Where you are or what you're selling, because you are at the end of the day a tradesperson, your trade is medicine, however, is time in the private sector. In the public sector, you don't have that privilege because the service is open to a lot who probably don't have the same access because of financial restrictions. But it is very difficult to ignore the lure of financial gain in the private sector, and money is attractive to everybody. It's an amazing drug that you get used to, and you get in, like it really is. And what you need to do is you just need to try and find that fine line that you should not cross just for the purpose of getting more. So as long as you're patient focused and you really want to help, what you get outside is good for you, but money should not be your main objective. But I would say we're really lucky in the UK in that the standard of practice, both in the private sector and the public sectors, is fairly similar. So that makes it a little bit easier for us to just basically try and sell time as opposed to anything else. But I have experiences in other places and have seen practices in other countries, and there is some sort of a gap between them, and the gap probably attracts the best of the surgeons to go privately, and then that makes the choices for patients a little bit more limited and restricted. But it's been such a long time since I've practiced in something in an environment like this, so I can't comment really on how that affects patients' care. All I know here is that where the difference lies in time.
So, Doctor, we know that every surgeon have that one memorable case. Could you share a bit about yours and the lesson learned?
It's interesting because, like, you think that there's one case that sticks with you. I don't think for me it was never one case, right? So I've done some really good work and I've had some complications, and I learned the hard way all kinds of different things. I think the thing that comes to mind when I talk about my cases is that where I started and where I am now are completely two different places. And that's because as you grow in your practice as a surgeon, because when you finish your residency, you really want to do the safe things, the things that you have learned in your residency, because that's what you're comfortable with. And then you start finding that the only way you learn is by stepping out of your comfort zone. But the comfort zone is usually a very guarded space for you during your residency. But when you're an attending or when you're a consultant, you're a lone wolf and everybody's looking at you. So you have to be very, very careful. But your learning only starts when you step out of your comfort zone. So that's one thing. And the other thing is that just because you are very good at doing something does not mean that it is the right thing. So I guess essentially reinventing yourself constantly is important. So one of the things that comes to mind is arthroscopy in orthopedics, and where we are now with endoscopy in spine, for example. You know, when endoscopy started, or when arthroscopy started in orthopedics, everybody thought, well, I know for a fact that my father was thinking, this is just like a load of rubbish, you know, you open up and do stuff. And then suddenly that changed massively. And like the kind of workload that he was doing in open erythrotomies and stuff like that stopped, because everybody, why would you do that? That's just such a savage thing to do to a joint. And now we're dealing with something really similar in spinal surgery, albeit a slow launch, but I think that's going to become bigger and bigger and bigger. And as budding spinal surgeons, I think you really have to look at that as I think surgeons there is a grandiose delusion that tends to consume all surgeons, including myself. You know, you're only important because you're doing the big cases. You're only important because you're doing the deformities, the tumors, the big en blocs, but that's really not the bulk of your practice. The bulk of your practice is basic degenerative work. That's what's going to be coming through your door. That's what's going to make you rich, except for some very select people who probably are privileged enough to just basically deal with deformities, as Erica would know in her setting and stuff like that. So, but that's absolutely fine. But the bulk of practice is not like this. So what you need to do is you need to have that skill set of doing, you know, like all things new, the MIS stuff, the endoscopic stuff, which I can't do yet for all kinds of different restrictions and logistics. But I think that's, for you guys, is probably an important thing to keep in mind, is that keep reinventing yourself, learn from your mistakes, share them with your colleagues, and don't be afraid to admit them. You're very likely going to be a very different surgeon in 5 to 10 years' time from when you started. And that's not a wrong thing to be.
Good.
Thanks for sharing all that information, Dr. Khalid. Now, we know that you are currently a faculty member of AO Spine, and it is important is it important for a spine surgeon to be part of an academic community like AO Spine? And in which way AO Spine influenced your career?
I think it's important to be part of something, right? I think it's important to be part of something for a number of reasons. One is it gives you some form of credibility, but two, it also allows you exposure to people who most probably you have not, or you would not have met otherwise. There will be also opportunities not just for learning, but also for teaching, which is another form of learning, really. And AO Spine is very good at that. So I would say that as a society is a good thing to be involved in. The open resources that AO Spine offers its members is also really valuable. I think value for money wise, when it comes to, for example, access to journals, educational videos, materials, and stuff like that, that's very good. So for somebody who probably needs an all-in-one solution, AO Spine tends to offer that better than a lot of the other organizations. There are other reasonable organizations also, and the more specialized you become, the more I would say targeted in your memberships become. But I think for somebody who is wanting a general exposure with good resources, I think AO Spine is a safe bet, really.
Great.
So you are a recognized research and educational leader in spine surgery. So to what extent it is important for a spine surgeon to also do research and teaching in general?
So I personally don't think that research is for everybody, right? I don't think that everybody's like, got the knack for research. And I think research, if you've done any academic degree, it is a very painful experience, really, and needs a special type of character to actually do it. But that's fine. And everybody looks at those guys that do it for guidance, and some people are much better than others, and that's why different surgeons rank differently amongst their colleagues. It has to be done for the right reasons, and I think that's important. It's not something patients are really interested in, and that's very, very important for you guys to know. It is important for you as a way of standing, it helps your standing amongst your colleagues. I think, however, that all, at least spinal surgeons, should be reasonable teachers. I think that's really important. I really like it. I think seeing how fellows come in and how they leave, and the level of competency surgically, their ability to reason and formulate management plans and stuff like that is very satisfying. So I enjoy that. I enjoy that quite a lot. I think it's really super important. And sometimes verbalizing that is difficult for some people, which is fine. But I think it's the mentorships through maybe observerships and stuff like that for some of the ones that might not be able to just communicate their knowledge is another alternative, which works really well. So I think, in short, it is important. All of it is important. I think teaching is probably much more universally required as opposed to research. And I think research has its own soldiers, and those guys tend to be really, I would say, really gifted that way and lucky. But that doesn't make teachers that are not researchers any less important. I think they're all very important.
Oh, that's right.
Sure.
Dr. Khalid, coming back to your career, what is the achievement you are most proud of?
So I thought about that a lot. I think there are two things that come to mind. I mean, every time you talk about achievements, you start thinking about the career. Actually, there are two things that I think are important to me. I think one of them is just being with my family. That's like having a very good, like, my daughter is probably my biggest achievement, right? And she has nothing to do with my career or anything like that. But from a professional viewpoint, I think the fellowship for me is really important. I think ultimately, all of you, after doing your job for about 5 to 10 years, you will be good at it.
Yeah.
It's like, it's very unusual to have somebody get to a stage where you are, who is not good surgically. And for the most part, you can teach people to be good surgically. Where so it becomes boring after a little while, doing all those things and all those deformities and all those decompressions. They're just not, they're no longer as exciting as they are to you today. But the whole bringing new spinal surgeons up, that is amazing. And that's constantly happening. It's just like everyone is a new challenge. And when they finish, you feel, okay, fine. You've got a new guy out there who is good, who's going to remember what you've done. People will get in touch with you for advice. They'll come and see you in meetings, and just those things are very important. And I think that probably for me is
definitely.
Mhm.
I think they just going.
Yeah. So, in this sense, if you could turn back in time, what advice would you give to the young you? And I mean, what would you have done differently?
So I think I was lucky. I don't think I've wasted time. I calculated everything, and I think the reason for this is that I've always thought about my career as a short-term and a long-term plan. I've noticed that a lot of the trainees lack that insight. They're just concentrating on the next step, and I think that that's really not as important as actually having a short and a long-term plan. I think when you're focused, so there was a guy I worked with called Brian Kwan from Vancouver, and he said to me, "Don't worry about your CV, just put your head down, keep working." Right? The CV will make itself.
Yeah.
And that's absolutely right.
It goes with time.
Yeah.
Exactly.
But I think that's a good part of this career, that your CV. So the career in general is long. So you will definitely learn. You never waste time. You're always, even if it's short or long type of career, it's always going to be longer than any other career. And I think in the world, at least, unless you're a scientific or something like that, or NASA or something. But you're always learning something, even when you're
correct.
just
And one
working.
of the things that you don't want to be doing is just repeating your life year after year doing the same thing, because that's just like like I think if you've come into spine with the passion of constant challenges and seeing new things and doing new things and different things and stuff like that, I see no reason why you should then accept with doing the same thing over and over and over again as a consultant. I mean, that just becomes super boring. And what's the difference between that and some sort of a very basic career in any other subspecialty? And part of reinventing yourself or making sure that you're constantly moving is actually having a plan. So I don't regret any step. I think every step I've done has made me what I am now, and I don't regret it. I just see sometimes people wasting away, wandering aimlessly, repeating multiple fellowships, multiple residencies, multiple whatever, and you start thinking, that's what a waste of a good talent, right? And that's where you guys need to spread that kind of word, that long-term plan, focus, get to where you want to get to, but keep that clear in your mind. There always also, that's another something that Naz Qureshi told me once, is keep your eye on the target, right? You keep your eye on the target. If you keep your eye on the target and ignore white noise, because along your career path, there will be people who would not want you to be as good as you are.
Yeah, sure.
because that would mean that they will not be what they want to, because essentially if you're better than they are, then that will make them look bad. And what you need to do is just forget that. Don't engage yourself or waste your time dealing with that kind of stuff. Focus on your targets, ignore the white noise. You will get where you want to get to. A lot of those really silly things that happen along the way will drop off simply because people who focus on the white noise will not be able to keep up with somebody who's focused.
Yeah, sure.
That's great advice.
It's a great advice.
Yeah, no, it's true, because if you pay attention to whatever others say about what you're doing, not doing, you end up completely frustrated or just thinking about all the things you might not be doing at the moment. But at the end of the day, you have a target. Whatever happens in the background, it should affect you. You just go and try to, yeah. So finally, we're going to engage in this quick game in which we ask you a question. It's a word, and the first thing that comes to your mind, you drop it. So I think that you can start with this.
Okay, so what's your hobby? What do you do in your free time?
I go to gym.
Yeah, and your favorite book?
My what?
Your favorite book?
My favorite book, I like Jack Reacher. So Lee Child. I love Jack Reacher, actually.
Interesting.
If you have any, what is your favorite sport and team?
I don't watch a lot of sport, actually.
Okay.
But if I was to, it would be a basketball match, because that's what we grew up watching when I was at school. And it probably would be a Chicago Bulls type of game, because I love Michael Jordan. I think his team was just amazing when he was playing. But that tells you how old I am with the
Oh my
God. What's your favorite surgery, sir?
Favorite
surgery?
Favorite surgery. I like adult deformity stuff. I don't have a pediatric practice. I know that there was a general description of deformity, but I really don't have any pediatric practice. So I do adult deformity stuff, and I really like it. It's getting me a little bit frustrated because of the complications, I have to admit, but I think that's part of the game.
Okay.
It's actually part of the game, yeah.
Now, do you prefer navigation or freehand?
I love navigation. I'm a very big navigation guy.
I think we're gonna know the answer to that one in this next question. Do you prefer open or minimally invasive surgery?
Whenever I can do minimally invasive stuff, I'll do minimally invasive stuff.
Yeah, you're an expert.
It's just so much better for the patients. Is that right?
Yeah, that's true. That's true.
Okay, so in one word, give us a word that defines spine surgery.
Exciting.
Good. When you hear the surgeon say excited, passionate, I like the fact that you always describe this specialty as something excited, something like to just look for something else. Like it's not boring. For sure, it's not boring.
It's not boring. It's even like I have not been in a decompression case, which is the simplest thing that you can do, where that case was exactly similar to one before. It's just always the anatomy is different, the challenges are different.
Now, finally, thank you so much, Dr. Khalid, for joining us today and for being a source of inspiration, motivation. You gave us a lot of information, and thanks again for all these advices for young surgeons of our OO Spine Youth Club. It has been really a true privilege, and thanks again. We really appreciate it. Thank you.
It's a pleasure. I think you guys are probably going to be the leaders of tomorrow when it comes to spinal surgery, and it's just so important that you guys have some sort of a good vision of what your mentors were doing. So
Yeah.
I would say not just basically to copy them, but to avoid all the mistakes that we've made, because
Yeah.
that makes your path much faster.
Yeah.
Thanks for
And
your
that,
kind words, Dr.
yeah,
Khalid.
thanks.
No problem. It's a pleasure.
Thank you so much.
Pleasure.
So enjoy your day. Let me
Thank you
just
very
stop
much.
here.
Thank you very much for asking me to talk to you.
Just
Take
Thank
care.
you. It's my pleasure.
Have a
Thank you.
nice
Thank you, Dr.
Bye-bye.
Khalid.